Hello, everyone. Welcome back. Another week and another ResearchWorks episode. Hi, Dana.
Hello, Ash. How are you today?
I'm good. I'm good. I'm
good.
excited.
I'm excited too because we have yet another great guest. The episodes have been fabulous since returning back to the season.
Yeah.
And here's no exception.
Well, another great guest, another great conversation for you this week. Welcome to the pod, Dr. Christopher Modlesky from the University of Georgia.
Welcome.
Thank you very much. I'm very happy to be here.
It's wonderful to have the opportunity to speak with you. We are looking forward to the topic of this particular paper today, which is currently up for the AACPDM's highest abstract honour, the Gayle G Arnold Award. And that just means in terms of scientific credibility and the content, it's something to look out for.
Yeah.
And the title of this paper is, wait for it, Effect of High Frequency, Low Magnitude Vibration on Physical Activity and Physical Function in Children with Cerebral Palsy, a randomised control trial.
So interesting.
So interesting. Lots of questions.
Yeah. Chris, we can't wait to unpack all that with you. But before we do, we will tell our listeners a little bit more about you. So Dr. Christopher Modlesky is the Athletic Association Professor of Kinesiology at the University of Georgia. He earned his PhD in exercise science from UGA in 2002. Leading the Neuromusculoskeletal Health Laboratory, his research focuses on bone and muscle health in children with movement disorders such as cerebral palsy, utilising MRI and vibration therapy to investigate physical activity interventions and mitigate long-term musculoskeletal deficits.
How good is that?
Yeah.
How good is that? Yeah.
And some ground we haven't covered before on the podcast. So we always love that, learning new things.
Yes, that's right. That's right.
So Chris, that's our formal getting to know you, but we obviously like to do an informal getting to know you as well. And we do that with our icebreaker question. So our question today, inspired by kinesiology, I think, when I was reading your bio, I thought this could be a little window into how our brains operate. If you could design a brand new Olympic sport that combined two random activities, what would it be?
Chris, do you have anything that comes into mind? Guess first.
Yeah. So, when I think of Olympic sports, I'm not sure if, I think this is an Olympic sport, curling. I really like curling.
Yes. Oh, yes.
Yeah. And equestrian.
Ooh.
Some type of equestrian and polo, something along those lines.
That would be
How it work, I don't know.
High
but
risk,
something that
high return.
High risk. Yeah, a lot of hard surfaces and high.
Oh gosh. That is actually a really good one.
Yeah.
Ed loves it. It's like, yes.
Yeah, bring it on.
I could imagine how that would work.
I don't know the rules.
No. Yeah, we can make them up as we go along.
That's fine.
That's a good
You're
one.
inventing the new sport, so you can do whatever you want.
I hope people are listening to that one. See, okay, when you said too random, I literally came up with really random, they're not even Olympic sports.
That's fine. That's great.
Okay, so
this question's open to interpretation.
Open to interpretation. Well, again, like you said, this is like an insight into your mind. Mine involves house cleaning. I feel like, so when you think about sports like gymnastics, right, you're rated according to not only like the execution of it, but also so the performance objective quantitative component. You also have a qualitative component, right? And I think the both are really important. So in house cleaning, I would say it would be like the time it takes. Let's just keep it 100 square meters to properly vacuum a space and then to stack the dishwasher in the most efficient, appropriate way. So you not only get a time
Speaking my language.
of doing it, but it's also the qualitative component. And that right there saves relationships. Boom. So those would be my
Fantastic.
I like
Thanks,
that.
Chris. Very random.
Yeah.
What
like
about
that.
yours, Ash?
Well, I had several ideas.
Yes.
Dressage is my favourite Olympic sport.
It is
and
great to watch.
so I thought that would be quite funny if you maybe tried to combine that with like dodgeball or something like that. So the riders trying to do their thing and trying not to get knocked off the horse while someone's throwing a dodgeball at them. So that would be quite fun. I
That's
also
like
thought
a show, like you can imagine a show being made out of that.
Yeah.
Yes. I love that.
I feel like no activity is really complete without karaoke. So I don't know what I would combine that with, maybe like marathon running or something.
How well you can keep your breath whilst you're running, when singing.
Yeah, or like weightlifting.
Yes, that'd be really good. Because you hear a lot of singers do say when they're training for playing and singing at concerts.
Taylor Swift famously
runs on a treadmill and sings. How did
Does
I
a whole
know
set
that?
list.
Yeah.
Make sure she can do a whole set list on the treadmill before she takes it on tour.
That's an Olympic sport.
Yeah.
With a functional outcome and impact all
There you
together.
go.
Okay.
All right, IOC, if you're listening, some suggestions.
I actually really want to see curling with polo.
Yeah, me too.
I think that would be great.
Yeah.
Yeah.
All right, there we go. Let's see what happens.
Let's see what happens. Well, let's. I'm sure all of our listeners are wondering how this relates to what we're going to talk about today.
Yes.
Let's bring it in for them.
Let's do it.
Okay.
All right. So, Chris, can you, changing tack just a little bit, can you talk to us about your career and your journey so far in kinesiology and what led you to focus on children with cerebral palsy in your research?
Yeah.
Mm-hmm. Well, so I actually went to the University of Georgia for my master's and my PhD. And while I was working on my PhD, I was also working as a research coordinator in a nutrition bone lab. And we studied nutrition, bone, and physical activity in children. And you mentioned gymnastics. We were looking at the effects of gymnastics on bone health.
Right.
Wow.
And so that made me interested in children. And then I worked with a muscle physiologist in Department of Exercise Science, same university. And he studied spinal cord injury. So that really got me interested in disability type research and looking at muscle and adding that to bone. And then I got a job at the University of Delaware, first in Department of Nutrition and Dietetics, and then we merged with exercise science. But the idea, my research idea going there was to combine children and spinal cord injury and look at kids with spinal cord injury and look at their bones and muscles. And right around that time, a paper had come out by Clint Rubin where he looked at the effects of vibration on bone in sheep and demonstrated a positive effect of the low-level vibrations on bone. So I thought I would try to introduce an intervention, that type of intervention in kids with the spinal cord injury, because they lose a lot of bone after their spinal cord injury and then probably never, really is always a tremendous deficit.
Yeah.
But I met an orthopedic surgeon in Delaware at the A.I. DuPont Hospital for Children, Dr. Freeman Miller. And he talked about cerebral palsy and how many kids they had, and how many issues they had. And I said, well, I think this is what, I'll study this. It seems like there's a lot to do here. And then as I worked more and more with the kids, I just saw how many issues that they had. It wasn't just bone, it was muscle. It was just a lot. And so that's kind of got me started. And that was in 2002, and here we are in 2025. So 23 years ago where it started.
I love that story, and how many great discoveries and intervention ideas come from that kind of journey as well, isn't it? An interest area, then you start to get into the clinical population, and it's applying those principles into a different population, which is very interesting, isn't it?
For sure.
You've touched on now already on vibration therapy. Can you help us to define what that actually entails, what's included within that?
Okay. Yeah, vibration therapy is a type of therapy in which a vibration stimulus is introduced to the body. It could be introduced in different ways, whether it be whole body vibration, somebody stands or sits or lies or leans against a platform that vibrates, or it could be delivered locally. So it could be delivered to a muscle, it could be delivered to a tendon, a joint. And the idea is that the vibration will have a positive effect on the muscle or the bone, or it'll have a positive effect on the central nervous system and lead to positive changes in maybe balance or coordination.
Right. That's really interesting. And what's the mechanism behind that effect that the vibration is having on the body?
Yeah, so there are different theories about how it works. So for what we're doing in this particular study, the idea is that we deliver a vibration. It'll have a positive effect on the muscle, and that positive effect will improve muscle performance, reduce spasticity potentially, and that would potentially increase physical activity. So how it works is maybe it's in theory it'll works on the muscle spindle. So the muscle spindle responds to stretch of the muscle, and so that stretch or that mechanism could increase somehow potentially reduce spasticity, increase activation of the muscle. It also may act as a work to decrease the amount of coactivation in the muscle that occurs. So in children with cerebral palsy, a lot of them have spasticity, and a lot of them have coactivation of their muscles. So muscle that should be working more is maybe not working as much, and muscles that shouldn't be working as much are working too much. So that's one potential mechanism. And then just these cells, mechanoreceptors like muscle spindles, Golgi tendon organs, and then joint receptors, and their interaction with the central nervous system, potentially the sensory motor cortex. So I think there are different mechanisms that have been proposed. We're still trying to figure out how exactly it works. So studying as many things as possible will give you better insight into how it's working, if it is working at all.
Thank you.
Yeah, really interesting. And, I've been on a vibration platform before, and it is quite a different kind of sensation, isn't it? And you talked about, some of the positive effects as well, but it's also like, I remember staying on one and having maybe the frequency set maybe a little bit too high, and you can sort of feel it as it goes through your body and into your head kind of thing. So there are different settings for it. It'll be really interesting to see what this does in this population.
Lots of different questions you could ask
for sure.
about it, I'm sure.
Yep.
So
and I think that's a key thing, the different ways that it's or the different settings, like the frequency and the magnitude, or the amount of vertical component, or whether it be vertical or side to side, but just the overall G-force that's delivered, and also the overall G-force delivered to the body may have different effects.
Yeah, for sure.
So Chris, this study focused on low physical activity levels in children with cerebral palsy. Physical activity for kids with CP is something that we've talked about a lot on this podcast. I think we know that, we should be trying to promote physical activity as much as possible. So this is a really interesting, I suppose, mechanism for doing that. What gaps in the literature prompted your investigation into vibration therapy as a way to promote physical activity in kids with CP?
Well, we didn't see any literature on. We knew that physical activity was low in children with cerebral palsy, and even in kids with the mildest forms of CP, were ambulatory, very mild, 30-40% lower physical activity than typically developing kids, maybe more. And our typically developing kids aren't very active. So to be lower than a group that's not very active isn't good. And also they have we've shown that they have a lot of fat in their muscles. They have a high concentration of visceral adiposity. We just published a paper showing that mild kids have higher, like elevated blood pressure, higher risk for hypertension.
Yeah. Gosh. It is such an important health issue, isn't it? And I think it is so valuable to look at it from all different angles of how we can influence this, because I think we're trying a lot of things, and it's whether it kind of like, does it stick? Can we change those behaviors, and can we actually impact lifelong? Because we know it's just so important.
Yeah.
Tying that together before we get into the methodology of your paper, Chris. So in this group of kids, I read that you were doing like high frequency, low magnitude vibration. Do you mind just breaking that down for us in terms of, like, again, it's part of the settings that we were just talking about before, wasn't it? Why did you choose that in particular, and what does that mean?
So that goes back to the studies that I discussed early on when we first started all this.
Yeah, okay.
And they were using, they called it high frequency. So high frequency between 30 and 90 hertz.
Oh, okay.
And then magnitude lower than 1 G-force.
Yeah.
And the idea is that if it's a low G-force, then you're at lower risk for having negative consequences associated with the vibration.
Yeah.
And also, I guess the way it's been described is, it's, if you have too much vibration, it's like a light that's too bright or a sound that's too loud.
Yeah.
So having just the right type of vibration may be beneficial to the kids.
Yeah.
So it leads back to those studies that showed a lot of them in animals that type of vibration seemed to be beneficial. And my root is in bone, so I was looking at the bone effects, and it took a long time to get this study funded, and there are different iterations. And the first iteration was a bone focus, and really the interest in physical activity and balance and coordination. It came from a parent who said, after being in our pilot study, saying that I feel like my child is falling less.
Wow.
So that made us interested in trying to expand the kind of work that we're doing. So looking at balance and coordination and muscle and how that potentially could affect physical activity.
Oh, that's really interesting.
Yeah.
I love that, because that's what vibration therapy is often, like, we know for, is about bone health, isn't it?
Yeah.
And then that's where it's been looked at probably the most famous ones are, astronauts when they come back.
Yes.
And, like, we always hear about things like that, right?
Bone density.
Yeah.
So, Chris, tell us about the study design and why you chose, we said in the title it was a randomised control trial, but talk to us a bit more about the details of that and why you decided to use this particular study design.
Well, it was just knowing at the time when we started all this, a lot of the studies in people with cerebral palsy, design was definitely a limitation. Sample size was a limitation. And we knew that we wanted to have the strongest study design to see if this really was effective. And we had seen read some other studies that were maybe showed positive effects, but the study design maybe didn't shake out the way, or it didn't look, it may have been a randomized controlled trial, but didn't have enough people. And then when they randomized, it didn't randomize very well.
Yeah.
So we wanted to make sure we had enough people that there was a randomized design. And also it was, we didn't just randomize, we got feedback from, like, when the kids were put in different groups. We started with a block design and then looked at our sample. And then there were other variables that we took into consideration when we were randomizing. So that led to a very, very tight sample as far as their height, their weight, their age. There's a little difference in the sex, gender, but not much, not statistically significant, but it's a very strong study design. So we didn't want there to be any questions about the design of the study and whether or not, and double blind, so nobody No one on our study team, none of the research assistants, the parents, no one knew what group, who was in what group.
Yeah.
So they were testing the kids and not knowing. So that was it's very powerful.
Yeah,
So there's
for
no
sure.
preconceived ideas of, there are ideas about what should happen, but there wasn't any tainting of the data. Not that people would do that, but we didn't want any perception that maybe something like that could happen.
Yeah, it's incredibly rigorous. And like you say, it really takes care of any, even subconscious.
Yeah, of course. Yeah.
Perceptions that people might be holding about, or expectations, sorry, thank you, about the treatment and the compared to the control, it really helps eliminate all of that and just tease out the effect of your intervention. So can you tell us then about that intervention? So what were each of the groups asked to do?
So the groups came in, all the kids came in, and then we tested them. And we did more than what we did as part of the trial. We have a lot of students, and they had other questions that they were interested in that we can also contribute to the next stage of this study. But we wanted to make sure that the kids could do all the testing that was asked of them. And we don't report it in this particular study, but they were like balance tests. We do report the lateral step-up test. So you needed to be able to do that test and, other things. So follow instructions. We just made sure everybody could do the testing.
Sure. And from a vibration platform perspective, like what was each group, like what was the intervention group asked to do? And similarly in the control group, they obviously thought they were receiving an intervention if it was double blinded as well.
That's right. Yeah. So all the kids got tested. And then those who were on the vibration group, we did some preliminary assessment to make sure that they were in the right group. But yeah, we knew what they knew, or they didn't know, but what the group would be. So they left with the platform after all the testing that was assigned to them. So they all went through the same exact testing.
Yeah, sure.
And the kids who were in the placebo group, they got a vibration platform that looked identical, and it sounded like a vibration.
Interesting.
But they didn't know what the other one sounded like. They didn't know what a vibration platform sounded like. So. And we said it was a low level, barely perceptible vibration. So they took it home, and then they stood on a platform 10 minutes a day for 6 months.
Wow.
And we went to their homes, and for those that we could, went to their homes and made sure we got compliance data. So we got compliance data at a month, and then at least at 6 months. So when they brought it back, we got compliance data. So there's a recorder that's inside of the platform that records when they step on the platform and they get off of the platform. So we knew when they used it, how many minutes they used it for.
Yeah.
And that's where, our compliance data, we had 83% and 78% of what they were expected to do. That's how much they did. So around average about 8 minutes a day instead of 10 minutes a day.
Yeah.
But that was really good.
Yeah.
That is not bad at all. And to be able to measure compliance objectively that way is so
Yes,
great.
I was just thinking, because often in studies you're asking families to report on things like that, and that can be, over a 6 month period. That's, potentially quite a burden and perhaps even a barrier to compliance.
Absolutely, yeah.
So
that's
to
right.
be able to collect that objectively, like Dana said, that's so powerful.
Yeah.
Yeah, just to make sure that was working, we also had parents record compliance, write it down on a sheet to kind of back that up. And then they came back in and we did all the testing again.
That's fabulous.
And then they waited. We don't have it in here, but 6 months later, after the vibration was removed. And at that point, after that, they found out what group they were in and if they were in the the placebo group, they got an actual vibration plate. If they wanted it, they could use it for 6 months.
That's fabulous.
Yeah.
That really is such an interesting way of, supporting children to be part of a study and looking at their compliance, which is just so part of what you look at implementation. 10 minutes a day isn't too much. And the fact they could do 8 minutes is really fabulous as well.
Yeah.
Your participant characteristics, they were all ambulant children with cerebral palsy, weren't they? So GMS level 1 and 2. What was their age group for this?
They were 5 to 11.
Okay, right. School-age children.
Yep.
Fabulous.
And I think on average they're about 8.5, both of the groups ended up. Yeah.
That's fabulous. Okay. And in terms of outcome measures, you sort of already mentioned there, so physical function, you've got 6-minute walk test and the lateral step, as well as some physical activity measures using accelerometry. Can you talk us through what that looked like?
Sure. Yeah. 6-minute walk test, just walk for 6 minutes. How far did you go? And then the lateral step up test, they just stepped up on a step up and down for 20 seconds. How long, how many steps can you perform in that period? And that was a measure of function, like some will say functional strength.
Yeah.
And then we had them wear the physical activity monitors. So they wore them on the hip and they wore them on the ankle. And we had them wear 2 at each site. In case one of the monitors didn't work, then we had a backup monitor. If we had both, then we just averaged the data. And then, we didn't see anything with the 6-minute walk test, but our functional measures, our 6-minute walk test, our lateral step up test, there were no changes in the kids with who received the vibration versus kids who received the placebo. And physical activity at the hip, the moderate physical activity, moderate to vigorous, went down, and the kids received the vibration, and the total physical activity went down.
Wow.
And sedentary physical activity went up relative to the controls. We weren't expecting that.
No. So how do you interpret those
we
findings?
Hypothesized that.
I mean, do you have any ideas
Besides surprising? I think when people hear that, they think, "Are you disappointed?" And I'm disappointed that it doesn't work. It didn't work like we thought it would, but that's why we do these studies.
That's
so kids and families could understand, is it working or not? So why do we think we saw what we saw? Well, there are exercise studies where they put people on exercise intervention, and then their non-exercise physical activity goes down. So, maybe that happened where they received the vibration, and so that activity that they were doing maybe took place of activities that they were doing before. The one counter to that is, or question that is raised related to that is, the kids in the placebo group did the exact same thing. So they stood on a platform.
Yeah.
And they did it for the same. There was no difference in the compliance.
Yeah, of course.
So it could be that the vibration stimulated some muscle activity, and maybe that activity was enough to, maybe subconsciously not participate in as much physical activity than they normally would. I don't know.
So interesting. I've got lots of thoughts. I wonder whether, how I was just describing when you're on the vibration platform, obviously you've got the control group who still had some, it sounded like one, they would have had that sensory experience. But whether that frequency and low magnitude, vibration was enough to feel just, it kind of took the place of wanting to be active because you probably felt a little bit more exhausted even just standing there for that time and being challenged in that position. And so as a result, you just don't feel like you want to engage in as much activity outside of that.
You kind of feel like you've ticked that box.
Yeah,
You're like, well, I did my,
you can feel
like you were
it.
saying, Chris.
Yeah, like if you stand on a vibration platform, there is this sense where you kind of go, whew, like you can actually really feel what that is doing to your body. And so maybe that feeling doesn't kind of endure you to want to do any more outside of that. I mean, that's an interesting thought in itself.
Yeah. And that the effort that's required to kind of maintain your body position during vibration, like is that
whether that's
tiring
it.
enough?
Yeah.
Given that they're not, you know, it's not an overly active population anyway.
That's right.
Yeah.
Because that's the main difference. If the compliance is the same and they were using it, you know, what was the difference? Well, surely that mechanical aspect had some role to play in their willingness and desire to actually engage in more activity, because you wouldn't expect that group to go down otherwise. But this just speaks to, I love how you've said this as well. Like I remember my mentor years ago said to me, Dana, when you're doing these studies, you actually have to be a scientist first and not be swayed by where you would like things to go, which is why you need to do these highly controlled studies, because you do have these, even though you don't want to, you do have these internal biases.
For sure.
And if you do a study properly, at least now you can kind of also say, in terms of time best spent, let's start looking at other things that you can spend your time on. And even if the difference is 10 minutes of doing something, if you're taking that away from something else that could make them more active, then we need to go down and pursue those paths, because 10 minutes is still 10 minutes in someone's day that might be already hectic. Like, I think the study is so valuable from that perspective, because it's just as good to know what things might in theory look really good. That is so prevalent also on social media. It's been really promoted and used in a lot of therapies, but what is the actual evidence?
Yeah.
And lots of thoughts.
Yeah.
Lots of thoughts, sorry.
That's why I'm here.
Yeah.
We're trying to get some feedback.
Yeah. Yeah. And Chris, you know, even though it perhaps wasn't, the findings weren't what you thought you might be able to write up, you know, you thought, you hypothesized that there would potentially be a positive effect.
Yeah.
You didn't find that in the study, but it's still an important piece of the evidence puzzle, isn't it? Like you're still contributing knowledge to this area.
Yeah.
And that will help refine the next iteration of questions and projects, won't it?
Yeah, there could be, when this started, whole body vibration, just standing there, receiving the vibration was what was being done.
Yeah.
More recently, people have been getting a stimulus and then doing something, so some sort of therapy. So it could be that you need to do something either during or after in order for the vibration to be effective.
Right.
Yeah.
Or maybe I said the stimulation was very low, very, very low.
Yeah.
It could be that maybe it's not enough. Maybe it needs to be a higher level above 1G. There are studies suggesting that these higher level vibrations may be effective. But one of the problems is they usually don't have a control group. And there's usually, it's in conjunction with something else. So it's not just vibration, it's vibration and this, or vibration and that. So it's if you're going to continue to head down the vibration road and look at these other types of ways to apply it, there have to be really good controls.
Absolutely. This highlights that.
Yeah, for sure. So based on that, Chris, how do the findings from your study shape your future research? You know, I think you've touched on a few different avenues that work looking at vibration therapy will go down, but specifically for you and your team, are there any alternatives that you plan to explore to address physical activity deficits in kids with CP?
Well, we have a lot of data from this study. We have a lot of biomechanics data. So we looked at gait,
Right.
those
Wow.
lateral step-up tests, these other tests.
Yes.
We assessed their biomechanics. We assessed their muscle activation. We did upper extremity work and looked at their accuracy, reaction time, doing different activities, different types of cerebral palsy, whether it be bilateral or unilateral CP. So this study has, we've used it as a way to do other things. So it's like we have this reservoir of data on kids and controls, like over 40 kids with CP with all these different measurements, and over 30 kids, typically developing kids, which we don't report here, but we have typically developing kids.
Yeah.
So we're going to use those data and actually try to separate out the kids based on, we'll try to do some machine learning, some clustering, and see if we can categorize the kids into different groups and see if we get the same result. So maybe there are some kids who did benefit, who their physical activity maybe went up, or some of the other measures that we collected, like muscle. Their muscle. We looked at muscle. We're going to look at muscle changes and other things, and it may be that some of these other components did change in a positive way in a smaller sub of the sample of the kids. And if we could identify those kids, then that would be great. And we'll be presenting some of, not vibration, but some of that type of work at the AACPDM.
That's fantastic.
Yeah.
There's lots to come from that, isn't there?
For sure.
And I think there's so much learning that can come from it. And, you know, when it comes to physical activity, let's make sure we look at that really carefully. What are our recommendations based on what we've seen here so far? Like, what's the time best spent? But it just shows task specificity is always, you know, it's part of it, isn't it? But if you're looking at the muscle, I'm glad you've told us about all the other measures. You know, it could have more of an effect at that level. So let's look at that.
And you start to understand, you know, what the process, what the pathway is for the best outcome in terms of physical activity. Yeah.
That is wonderful. Well, look, we're not done yet. I'm sure Ed will have a few questions on this. So let's head into the final segment here, Chris. We're going to go into Tell It to Ed. Ed, as you know, is our producer. He doesn't have a background in child health. He's been working really hard today and all of the buttons and faders and things like that to make this all work. But before Ed asks you a question, Chris, I'll get you to summarize this work that you talked about today in about 60 seconds or so. And Ed, you'll have time for one question. Take it away, Chris. Time starts now.
Okay. So children with cerebral palsy have low levels of physical activity, and much of that is probably linked to their lower deficits in their functional ability. And it's been hypothesized that low or vibration, whole body vibration, may have a positive effect on muscle balance, coordination. So our interest was in determining whether or not introducing kids to a vibration stimulus for 6 months, 10 minutes a day at a low level, resulted in positive changes in their physical activity and their overall functional ability. And what we found is that it did not. It actually, the children who received the vibration had a reduction in their total physical activity and their moderate to vigorous physical activity, and an increase in their sedentary activity. So the reasons for that, we're not quite sure. It may be that some of the activity with doing that type of work, or that vibration exposure, may have replaced some of the activity that they would have done before. So whether or not we would recommend vibration, this study does not support that recommendation, but more work needs to be done. It may have some benefit to someone, but overall, we didn't see that benefit in this particular study. Randomized controlled trial, double blind, so no one knew what the outcome was until the end of the study.
Great summary. Well done. Thank you, Chris. All right, Ed, do you have a question?
Yeah, look, I do. I've obviously sat through quite a few of these episodes. This is now number 251, I believe.
Wow.
So we've hit a nice little milestone. But over that time, I think I've asked some good questions, some silly questions, and sometimes I've struggled to ask a question. And the last couple of times, I've kind of asked something that's a little bit more devil's advocate. And I appreciate that researchers are very careful with their language. So they present the facts, and when they don't know about something, they admit that they don't know about something or that the evidence doesn't point in that particular direction. And I guess my question is about the people who would still advocate for this, because there would obviously be still, there's quite a market for this kind of vibration platform. And I don't want to use ambiguity, but the slight where the evidence is not 100% or definitively saying that this doesn't work, what is it that people would actually hold on to suggest that, look, this study doesn't actually address why I do it for my client? I'm just wondering what the other side would be saying about this.
Yeah, so maybe there are some benefits that were not studied in our study that may still offer, maybe some benefit to someone or for something. Well, like I said, it could be that there are certain populations that may benefit from this. It could be that different types of cerebral palsy may benefit from this.
Okay.
It could be that maybe a higher level of vibration, but the way we delivered it and the population that we delivered it to, this does not support that. But there might be other groups and other things you may study that it may offer some benefit. So if somebody really wants it to work, then I'm sure they could find some literature that would suggest that it still has some possibility.
Just a really quick follow-up question to that then, and you'll have to forgive my ignorance in the matter. I'm an IT guy, not a health professional. But your study, would that be reflective of how vibration platforms would be used as a general rule of thumb?
Like in clinical practice?
Yeah. Is it representative of what others would use? Yeah.
I think that probably more people are using a more localized vibration right now. So I think if that may be another thing that people are holding on to, is like, this was delivered, you're just standing there.
Okay.
I'm doing it where I'm applying it to a specific joint or muscle, tendon, and if I'm a therapist and I'm seeing some benefit to my patient or the person I'm working with, then maybe it's not in a study, but I see it in my practice. There are other types of interventions that or treatments that people use, and with CP that they think it offers some benefit, so they will do it. So like botulinum toxin, people use that. And I think it probably depends on the whoever's delivering it and whether or not they're seeing some benefit.
Yeah. Lots of discussion, isn't there, around something like this?
Yeah. And I think your point, Chris, kind of speaks to that tension between how quickly things move in clinical practice versus how quickly we're able to move in the research space. You know, you mentioned that it took quite a long time to get funding and support for this project to get underway. And by that time, you know, clinical practice is starting to shift to another version of vibration therapy already. So you're kind of playing catch up a little bit, aren't you?
Yeah.
So this would be like if you go to a gym, somebody might be doing this, or like somebody who's older may have it at home and they're thinking it might reduce their osteoporosis risk.
Yeah. It's it's a really interesting space, and we're really grateful that you gave up your time today to talk us through it. We look forward to hearing the rest of the work. It sounds like, it's such a big study and so much data that you have that will be coming out over the coming years.
Yeah, possibly years.
So we look forward to staying across that.
Yeah, thank you so much, Chris. It was really just so fabulous to have this kind of conversation, and I really encourage everyone who's going to New Orleans or even thinking about going, just go and have these kind of conversations with researchers, like this was unexpected and why, and, I think that's the power of presenting this data, and we're following the evidence, and that is our role as scientists, isn't it? So really encourage everyone to go and chat with you. You've all seen what he looks like now, so you can find him at the conference. So head over to our website, ResearchWorks.net. We'll put a summary of what we've spoken about today, and as well as links to AACPDM as well if you're thinking about going. Really encourage you to take a look at all of that because there's still time. And also, of course, ResearchWorks.academy if you want to have a fuller experience of how you can implement all of this research into your practice. But for now, we should say goodnight to you, Chris.
Yes. Good night and enjoy the conference.
Much. Thanks for having me.
Thank you so much for joining us. And to all of our listeners, we'll talk to you all again really soon. Bye.
Bye.